Schizophrenia, characterized by psychosis, altered cognition, perception, and reality testing. Stages with signs and symptoms. Premorbid phase occurs before there is clear evidence of the illness. Poor peer relationships, withdrawn and introverted. Prodromal phase. Mild onset changes, delusions, hallucinations, mild changes in thinking, insufficient to meet diagnosis of schizophrenic. Acute psychotic, exacerbation of symptoms. Residual phase. Symptoms are absent or no longer prominent. Positive symptoms improve, negative symptoms remain. Hallucinations. Hear, see, smell, or feel things no one else does. Age of disease development, 15 to 25 years old. Undifferentiated schizophrenia, subtype of schizophrenia. Disorganized schizophrenia, disorganized speech, disorganized behavior, and a flat or inappropriate affect. Schizoaffective disorder, a combination of symptoms of schizophrenia and mood disorder, such as depression or bipolar. Symptoms may occur at the same time or at different times. Schizophreniform disorder. Duration of the disorder has been at least 1 month, but less than 6 months. Positive symptoms. Highly exaggerated ideas, perceptions, or actions that show the person can't tell what's real from what isn't. Negative symptoms. Absence of something that should be present. Use of MSE. Assessment used to determine cognition. 12-step programs. AA, Al-Anon, Alateen. Catatonia. Hold distorted postures for extended periods of time. Anhedonia. The inability to feel pleasure. Preservation. The persistent repetition of word, phrase, or gesture. Tangentiality. Veering away from the topic of discussion and demonstrates the difficulty in maintaining focus and attention. Paranoia. Be honest and consistent. Avoid talking, laughing, whispering when the patient cannot hear what is being said. Referential thinking. When a person believes that the public forms of communication like song lyrics or gesture from a TV host are a special message just for them. Circumstantiality. The individual delays in reaching the point of communication because of unnecessary and tedious details. The point or goal is usually met, but only with numerous interruptions by the interviewer to keep the person on track. Loose association, word salad, jumble of words meaningless to a listener. Delusions of influence, thought broadcasting, thought insertion. Delusions of persecution, the feeling someone is after you or that you're being stalked, hunted, framed, or tricked. Magical thinking or superstitious thinking, the belief that unrelated events are casually connected despite the absence of any plausible causal link. Step on cracks in the pavement will cause bad luck or injury to others. Echopraxia, imitates movements made by others. Echolalia, pathological repetition of another's words. Depersonalization, feelings of being detached from oneself. Aphasia, the loss of language ability. Akathisia, restlessness. Dystonia, involuntary movement of face, arms, legs, and neck. Confabulation, creating imaginary events to fill memory gaps. Agnosia, the loss of sensory ability to recognize objects. Neologism, meaning for the patient only they understand. Regression, retreating in response to stress to an earlier level of development and the comfort measures associated with that level of functioning. Clanging association, words chosen based on the sound. Somatic delusions, these center on the body. The person thinks they have terrible illness or bizarre health problem like worms under the skin or damage from a cosmic ray. Delusions of grandeur, they consider themselves a major figure on the world stage like an entertainer or a politician. Tardive dyskinesia involves uncontrollable movement or shakiness in your jaw, lips, and tongue. Acute dystonia. Muscles contract involuntary and can cause repetitive or twisting movements. Waxy flexibility. This is when a person puts up some slight, even pushback or resistance to any attempt to change their position. Then their muscles slowly release and their limbs bend like a warm candle. Extrapyramidal symptoms. Muscle weakness, restlessness, dystonia. Anti-motivation syndrome. Changes in personality, emotions, and cognitive functions such as lack of activity. Opioid use, abuse, and withdrawal. Use is euphoria, lethargy, drowsiness, and lack of motivation. Abuse is constricted pupils, decreased respiration, decreased blood pressure, and slurred speech. Withdrawal is insomnia, irritability, rhinorrhea, panic, diaphoresis, and cramps. Stimulant use, abuse, and withdrawal. Abuse is dilation of pupils, dryness, and nasal cavity, excessive motor activity. Intoxication is euphoria, grandiosity, fighting, elevated vital signs, nausea, vomiting, and psychomotor agitation. Withdrawal. Anxiety, depressed mood, insomnia, hypersomnia, craving, and suicidal ideations. Alcohol use, abuse, and withdrawal. Use is a sedative, creating an initial feeling of euphoria. Abuse is sexual or aggressive impulses, mood liability, impaired judgment and functioning. Withdrawal. Early signs within 4 to 12 hours of cessation or reduction in heavy or prolonged alcohol use. Peaks within 24 to 48 hours. Mild withdrawal. You experience hand tremors, impaired appetite, and tachycardia. Moderate withdrawal is visible tremors, restlessness, and insomnia. Severe withdrawal is gross, uncontrollable shaking, extreme restlessness, dry heaves, and vomiting. Ketamine use, abuse, and withdrawal. Use is visual hallucinations, disorientation, confusion, paranoia, euphoria, anxiety, panic, and increased pulse. Abuse is belligerence, impulsiveness, psychomotor agitation, increased heart rate and blood pressure, ataxia, seizures, panic reaction, and delirium. Caffeine is most widely used psychoactive substance in the world, can result in intoxication and withdrawal. Cannabis is the most widely used illegal drug in the world, fourth most used psychoactive drug in the U.S. after caffeine, alcohol, and nicotine. Its use is relaxation, talkativeness, lowered inhibitions, euphoria, and mood swings. Abuse is impaired judgment, loss of recent memory, tremors, and muscle rigidity. Withdrawal is nervousness, tremor, insomnia, restlessness, conjunctival redness, panic, and paranoia. Diazepam relieves acute agitation, tremors, impending delirium tremens, and hallucination. Medications. Risperidone. Signs for agitation, aggression, hallucinations, thought disturbances, and wandering. Side effects is fever. Adverse is EPS. Haloperidol. Used to manage the positive symptoms of schizophrenia, including hallucinations and delusions. Adverse effect is tardive dyskinesia. Chlorpromazine is used for phenothiazine neuroleptic. It's an antipsychotic agent. The side effect is pain and irritation at the site of injection. Adverse effect is tachycardia, ECG changes, hypotension, cardiac arrhythmias, EPS, and TD. Medication used in addiction recovery. Disulfiram is for alcohol. Any consumption of alcohol means violent nausea and vomiting. Naloxone, which is Narcan, treats opioid toxicity and it's short-acting. Nalmefene, which is Revex, longer half-life but prolongs withdrawal. Methadone is a detox tool, synthetic opiate that blocks the craving for and effects of heroin. Clonidine affects somatic treatments when combined with naltrexone. Buprenorphine blocks the signs and symptoms of opioid withdrawal long-term. And naltrexone is an antagonist that blocks the euphoric effects of opioids in its long term. Delirium and dementia. The signs and symptoms of dementia is progressive decline in cognitive ability in the presence of clear consciousness, cognitive defects, and significantly impaired social and occupational functioning. Signs and symptoms of delirium. There's 4 cardinal signs: acute onset and fluctuating course, reduced ability to direct, focus, shift, and sustain attention, disorganized thinking, and disturbance of consciousness. Both delirium and dementia patients can exhibit signs of confusion, anxiety, agitation, and disorganized thoughts. Delirium is the most frequent complication of hospitalization in older adults. Neurocognitive disorders. Its cognitive functions likely closely linked to particular areas of the brain that have to do with thinking, reasoning, memory, learning, and speaking. Predisposing factors for delirium: systemic infections, febrile illness, and metabolic disorders. Emotional instability, manifested by fear, anxiety, depression, irritability, anger, euphoria, or apathy. Reminiscence, elderly individuals share significant past events with peers. Types of dementia: vascular dementia, small strokes that destroy many areas of the vein. Pseudo-dementia, depression. Cognitive symptoms of depression often mimic those with NCD. Sundowning, the tendency for the mood to deteriorate and agitation to increase at the later part of the day or night. Stages of Alzheimer's. Stage 1, no symptoms. Stage 2, forgetfulness. Stage 3, mild cognitive decline, difficulty recalling names. Stage 4, mild to moderate cognitive decline, confabulation, forget significant events. Stage 5, moderate cognitive decline, loss of ADLs, forgets address, disorientation is apparent. Stage 6, moderate to severe, disorientation is common, and incontinence. Stage 7, severe cognitive decline, aphasia, bedfast, and unable to recognize family. Caregiver role strain, feelings of stress in relationship with care receiver, feelings of depression and anger, family conflict around issues of providing care. Medication causing delirium, that's benzos and anticholinergics. Use of lorazepam, commonly used if etiology is substance withdrawal, severe symptoms, and delirium.